My name is Delstreet Benjamin, and I am here today to talk to you about depression. Depression is a silent but deadly mental issue. There are many different types of depression, but today I chose to focus on clinical depression, its signs and symptoms, and different ways it can be treated. According to Matt O'Connor, the author of the Silent Clinical Depression, published in thestreetdirectory.com in 2016, in thestreetdirectory.com, accessed on March 30th, 2016, in the United States, about 15% of severely depressed people commit suicide. 2/3 of those people have been seen by a healthcare provider during the month of their death. Clinical depression is a serious and very touchy subject to me because I was diagnosed with clinical depression and severe anxiety in 2010 while serving in the Navy. Not too many people understand the severity of clinical depression. That is why I chose this topic. When people look at me and say, "Oh, you don't look like anything's wrong with you. You just need to get over yourself," it hurts. I believe people think that people who suffer from clinical depression are supposed to walk slouched over with the head hung low. That's not the case. Not having people understand how you feel or what you're going through can make your depression worse. Today I'll explain to you what clinical depression is, its signs and symptoms, and how it can be treated. Let's start with clinical depression. Let's start with what clinical depression is. According to dictionary.com, accessed March 30th, 2016, clinical depression is the more severe form of depression. It is a depression so severe as to be considered abnormal, either considered to be abnormal, either because of the obvious environmental causes or because the reaction to unfortunate life circumstances is more intense than would generally be expected. Clinical depression is also known as major depressive disorder, according to Major Depressive Disorder by the Mayo Foundation for Medical Education and Research, published in 1998 in the MayoClinic.com, accessed March 30th, 2016. In order to be diagnosed with clinical depression, you must meet certain symptom criteria for major depression in the Diagnostic Statistical Manual of Mental Disorder, also known as DSM, published by the American Psychiatric Association. Now that we know what clinical depression is, let's talk about its signs and symptoms. Major depression, clinical depression, published in the WebMed in 2005, accessed on March 30th, 2016, says that there are many different signs and symptoms to help recognize a person that is suffering from clinical depression. A constant sense of hopelessness and despair is a sign of clinical depression. Sometimes clinical depression can be genetically inherited, but it can also affect people without a family history. To be diagnosed with clinical depression, you must show certain symptoms every day for at least 2 weeks. Some of those symptoms include sadness or empty mood, feeling guilty or worthless or helpless, problems concentrating, remembering, or making decisions, lack of energy or feeling tired and slowed down, problems sleeping, along with other signs and symptoms. Almost twice as many women than men suffer from clinical depression due to hormonal changes during puberty, menstruation, pregnancy, miscarriage, and menopause may increase these risks. We found out what clinical depression is and some of its signs and symptoms. Now let's see how it can be treated. Clinical depression is a serious but treatable disease. Some doctors may describe antidepressants depending on the severity. Some may add other medications to the antidepressants to help boost the effect of the medication. They may also try different doses of medication because what works for one may not work for the other. Some may also recommend psychotherapy or talk therapy or maybe even shock therapy. In conclusion, Depression is everywhere. It is important for you all, the audience, to know the signs and symptoms of depression and what can be done to help a person cope with what they are going through. Clinical depression is a serious mental illness. If you know someone who's suffering from it, let them know there are places to go and places they can call to get help. Thank you so much for your attention. Are there any questions?
No, thank you. Very good presentation.